Hello, and welcome to Dr. Sarah's Health Channel. Many believe hormones like estrogen and testosterone are solely for reproduction, but they play crucial roles in overall health, especially as we age. They influence everything from bone density and muscle mass to mood regulation and cardiovascular health. In this first part, we'll define what normal means for estrogen and testosterone levels after 50, explore factors affecting them, and discuss initial symptoms of imbalance. So, what do doctors consider normal for estrogen and testosterone in women over 50? It's a common question, and the answer is nuanced. For postmenopausal women, normal estrogen levels, specifically estradiol, are typically below 30 picograms per milliliter, often ranging from 0 to 30 picograms per milliliter. To put this in perspective, premenopausal levels can be much higher, between 30 and 400 picograms per milliliter during cycles. Think of estrogen like a thermostat for your body, regulating temperature and metabolism. After 50, that thermostat is set to a lower, but still functional range. Total testosterone levels in women over 50 average 15 to 70 nanograms per deciliter, with free testosterone, the active form, at 1 to 6 picograms per milliliter. These levels are about half of what they were in younger women, reflecting a natural decline. Testosterone acts like an engine maintainer, crucial for energy and strength, even in smaller amounts. Reference ranges are established by reputable organizations like the North American Menopause Society and the Endocrine Society, ensuring medical accuracy. Now, let's delve into the key factors that affect these hormone levels after 50. The primary event is menopause, defined as 12 months without menstruation, typically occurring around age 51 in the US. Estrogen plummets due to reduced ovarian production, shifting reliance to adrenal glands and fat tissue. Testosterone also declines due to aging and menopause-related ovarian changes, with about a 1 to 2% annual loss after age 40. Lifestyle factors play a significant role. Diet, for instance, can influence hormone balance. Phytoestrogens found in soy, for example, may mimic estrogen, as studies from the 1990s onward have shown. Exercise is another crucial factor. Weight-bearing activities preserve bone density, which is linked to estrogen signaling. The CDC recommends 150 minutes of moderate-intensity exercise per week. Stress also impacts hormone levels. Elevated cortisol, the stress hormone, can suppress gonadal hormones. This connection has been explored in neuroendocrine research since the 2010s. Obesity is another consideration, as adipose tissue can convert androgens to estrogens, potentially elevating levels in overweight women. Environmental factors, such as endocrine disruptors like BPA in plastics, identified in the 1990s, can also interfere with hormone balance. Understanding these factors helps us appreciate the complexity of hormone health after 50. Now, let's discuss some initial symptoms that might indicate a hormone imbalance. Common early signs of low estrogen include hot flashes, affecting 75 to 85% of women and lasting 7 to 10 years on average. Night sweats, vaginal dryness, and fatigue due to disrupted sleep are also prevalent. Mood swings linked to serotonin modulation and bone loss, with a 1 to 2% annual density drop post-menopause, are other indicators. For low testosterone, symptoms include reduced libido, affecting 25 to 50% of women, and muscle weakness. Sarcopenia, the loss of muscle mass, accelerates after 50, with a 3 to 5% loss per decade. Low energy and irritability can also be signs of testosterone imbalance. It's important to remember that these symptoms can overlap with other conditions like thyroid issues or depression, so medical evaluation is key. Reassuringly, many symptoms are manageable, and 80% of women experience only mild effects, according to NMS data. In summary, understanding normal hormone levels and their fluctuations after 50 is crucial for women's health. We've covered what normal means, the factors influencing these levels, and the initial signs of imbalance. Remember, these hormones are vital for your overall well-being, far beyond just reproduction. In our next video, part 2 of this series, we'll dive deeper into the specific symptoms of high and low levels and what they mean for your health. Join me for part 2, where we'll explore diagnostic tests and natural balance strategies.